Hi everyone, welcome back to the TinyDocs Talk podcast series, Pediatric Interview Edition, your source for the clinical thinking station or clinical reasoning station of the pediatric training interview in the UK. This is brought to you by the British Sudanese Association of Pediatric and Child Health, or BSAPCH in short. I'm your host, Isra Ibrahim, and today we have our presenter, Guiria Ibrahim. She will present a real life demonstration case of clinical thinking station. So, without further ado, let's dive into our episode.
You are called by the ambulance that they are bringing a 6 years old child who is known to have allergy. His mother said that after he is eating and fish, he developed generalized skin rash and respiratory distress and cough. It looks I'm dealing with the case of anaphylaxis due to his background of allergies, and after eating this fish he developed this reaction. I have to activate the emergency response system, and I will inform my senior and I will delegate the role to my team. Then I have to manage this patient in resus room. I will push him immediately to the resus room. I will try first to connect him to the monitor and pulse oximeter. If there is any evidence of any remnant of fish in his mouth, I have to remove the allergen. I have to put an oxygen by non-repressive mask. Then I will give IM adrenaline 1 in 1000 intramuscularly, and then I have to move to approach this patient with the ABCD approach. Regarding the airway, so I have to make sure that there is patent airway. If there is a partial airway, if there is a complete airway, so this is an I have to inform the anesthesia. I have to consider to bit and advanced airway or surgical airway. If there is partial obstruction, I have to monitor his saturation. If it's still not improving, I have to give a second dose of IM adrenaline, and I will give him also nebulized adrenaline. And nebulized adrenaline can be given every 10 minutes. So I will move to the circulation, as this patient in anaphylaxis, so most likely is having compromised circulation. So I will put immediately an IV line, and I will give him an IV hydrocortisone, and also I will consider to give him an IV salbutamol. If he's still no improving, I will give him the third dose of I am adrenaline. Then I will move to the disability to assess his level of consciousness by Glasgow Coma scale, to assess his pupils and to check his blood glucose. If it's still no improvement, I have to give an IV chlorampheramine and IV salbutamol, and the fourth dose of IM adrenaline. If still no improvement, I have to consider to give an IM infusion of adrenaline, but I have to contact with the PICU. So, according to the severity of reaction and the airway, I will manage this patient. I will ask one of my team to bring the protocol and anaphylaxis, and we will manage accordingly. Then I have to update the family by the situation, and I have to take and focus history. I will ask about the event, what is the exposure that lead for this event, what other symptoms like shortness of breath, vomiting, diarrhea, abdominal pain. I have also to ask about any past medical history of similar reaction, severe reaction, any PICU admission, any past history of severely increased reaction, any history of choking. I will ask about his medication, if he is used EpiPen. I will ask also about last meal. Then I will do and examination from head to toe, examine his chest, his abdomen. Then if there is a severe anaphylaxis, I have to admit this patient to the PICU, and after stabilization, I have to do a debriefing session to assess our performance, what done in right way and what done in the right way. So we will see the positive and negatives and to improve our performance for next cases.
As we wrap up today's episode, me and Bisab CH would like to extend our thanks to our presenter, Guiria Ibrahim. Thank you for sharing your insights with us. We hope this episode has provided simulation-like guidance for the clinical thinking station in pediatric training interview. Remember, our journey does not end here. Be sure to check out the rest of our podcast, our YouTube channel, our website for more information. Your feedback is valuable. We invite you to reach out and share your thoughts, question, or suggestion. Together, we can continue to improve and provide content that meets your need. Thank you for tuning in, and until the next time, stay curious and keep learning.